At nursing homes like this one, families have been telling 13 News they cannot get information about the coronavirus inside.
We need to know how many deaths are over there and how our family members are being taken care of.
13 Investigates has learned more than 100 seniors at Greenwood Meadows have gotten COVID-19. At least 27 have died, including Daw Hubbard. His family tried asking questions every day, but they say the nursing home never admitted the virus had spread like wildfire.
My dad could be alive right now if they had only provided that information sooner so we could have done something to take him out of that place.
It's why 13 Investigates has been trying to get data about COVID-19 in each of Indiana's nursing homes. State health officials collect that data every day, but they refuse to release it, providing only statewide totals.
At this point, that is the extent to which we want to report data.
Asked if the governor will require that information to be released,
I will not.
He declined. Even though many other states do release detailed nursing home data, Indiana will not. And while the state keeps the information secret, deaths inside Indiana nursing homes have jumped 360% in just 3 weeks. State Representative Ed Delaney says it's a statewide crisis.
That industry is going to collapse if it can't play straight with us. And the governor should not help the nursing home industry collapse. How many people have been infected? How many have been hospitalized? How many have died? You know, those are the numbers that really matter. And those are the numbers we need.
Some nursing homes have released that information on their own. Otterbein Senior Life and Hearth Management, for example, release their numbers whenever asked. Trilogy Health Services is posting information daily, detailing COVID-19 data at each of its 20 nursing homes in Indiana. But most nursing homes are not doing that. Cardon is not publicly sharing COVID-19 deaths about most of its nursing homes in the state. Communicare told 13 Investigates it won't provide data for any of its 20 Indiana locations. And American Senior Communities, the state's largest nursing home operator, will not publicly release COVID-19 cases and deaths for its 78 long-term care facilities. And it won't even explain why, frustrating many families who have loved ones inside.
I feel helpless.
Can you think of any good reasons to hide and to withhold this information and to keep it confidential from the public?
No.
Sarah Waddle is the state director for AARP, which represents more than 800,000 seniors in Indiana. She says state guidelines that simply suggest that nursing homes share coronavirus information with their customers are not good enough.
We know that there are instances where people aren't getting the information that they need. And I think we're really to a point where it's not working. And there's one really easy way to clear all this up, and that's just to make the information public.
Since most nursing homes are not releasing the information and state leaders won't require it, 13 Investigates has found a different way to gather nursing home data for the public. We've been collecting nursing home COVID-19 information from county health departments, which are also required to release public data. Some have still refused our request. Marion and Morgan counties, for example, will not release COVID-19 data for a single nursing home. But most central Indiana health departments are now releasing data showing the number of COVID-19 cases and deaths at each location. 13 News has compiled that information into a database that you can search right now at WTHR.com. It includes more than 100 long-term care facilities where there have been nearly 1,000 cases of COVID-19 reported, resulting in nearly 300 of the state's nursing home deaths. And we're adding more locations to the database every day. Even though the state has been allowing nursing homes to keep their COVID-19 data secret, the Centers for Medicare and Medicaid Services think that data is far too important to keep hidden. The agency just announced that it is going to start publishing COVID-19 case and death information for just about every nursing home in the country, and it hopes to have that ready to go by the end of the month. In the meantime, you can see much of that data now at WTHR.com.